Hello, everybody. Today we are going to be talking about IBS. My name is Abby Benham, and this is kind of going to be a more in-depth view of what IBS is, the different subsections of IBS, and then we also have a fun activity that we are going to be doing at the end of this presentation. So let's start by asking, what is IBS? How can we classify IBS? Well, IBS stands for irritable bowel syndrome, and it is a gastrointestinal disorder characterized by cramping, abdominal pain, bloating, gas, or diarrhea or constipation, or both. And it occurs in the large intestine. And it's more common among women and people under the age of 50, as well as people who live in America, specifically because of our diet culture and ingredients that are added in our foods. And it affects around 10 to 15% of the US adult population, and only 5 to 7% go to the doctor to receive a diagnosis. So there's still, about half of the individuals who have it today are not getting it checked out by a doctor, which is really important with considering trying to help these individuals. So let's look at some risk factors for IBS. We kind of talked about people. It commonly occurs with them from teenage years to their early 40s or 50s. And for women, it's actually 2 times more common than it is for men to develop IBS. And also, familial history is related to IBS as well. So if your mother or father or grandparents had it, you are more likely to obtain it. It also is caused by emotional stress. So if we, have something stressful in our lives that's put on our bodies and we're not relieving that stress, it can take a toll on our digestive system. The gut is the second brain. And so, it can react to things just like our mind can react to things because they're directly connected. And food allergens and intolerances can be linked to IBS. I will talk a little bit more about this later. But also, if one is in an abusive environment, like if they have spousal abuse or parental abuse or things like that, it can also develop because of that. And also having another gastrointestinal disease can cause IBS. So we could think of something like Crohn's disease or ulcerative colitis. And triggers for IBS can include different foods, medication, and again, stress. And looking over articles and stuff, there isn't really a prevention method or necessarily a cure, but it can be controlled very well with proper diet care and management, or including medications from the doctor. And there are actually 3 types of IBS that we are going to be discussing today. It's IBS-C, IBS-D, and IBS-M. So first, we're going to be talking about IBS-C, and IBS-C stands for irritable bowel syndrome constipation, and it is characterized by hard and lumpy stool. And some of the signs and symptoms we can see here, it's usually, pain in the stomach. We might have some gas issues. There might also be some rectal bleeding if it gets too out of hand. And also, they do not go to the bathroom as frequently. And then the stools kind of look like pellets. It's not really a cohesive mass. And for tests for diagnosis, there's 3 methods that they can use to test. One is a colonoscopy, so they will insert a scope through the anus and into the rectum and the colon to look for irritation, swelling, and polyps to determine, if they're constipated or if they're, having regular bowel movements or if their digestive system is working properly. Another method is an X-ray or a CT scan, which I have provided an example here for you. So we can see, down next to the rectus and anus, or rectum and anus, sorry, that it is kind of almost like pellet looking, and it's all kind of just formed and fused into one and kind of stopping up the flow of digestion. And another thing that you can do to test for IBS-C is a breath test for bacterial overgrowth. And this is a non-invasive test, so it doesn't require a surgical procedure or any type of machinery, really. I mean, it does require machinery, but not like extreme machinery where you have to go through a bunch of steps. That measures the amount of hydrogen or methane that you breathe out after drinking sugar water. And this is done to look at bacteria in the small intestine to assess the speed of digestion. So with IBS-C, if it's untreated, there can be a few complications that can occur. One would include anal fissures, which is tears in the anus. And then fecal impaction can also occur, which is where, like we saw in the X-ray, fecal matter can kind of combine into this thing where it's hard to expel, which can be very painful. And hemorrhoids could also develop from fecal impaction, which is also another sign of complications with IBS-C, which is where the veins around the rectum and anus get inflamed. And rectal prolapse is also something that could occur, which is pretty much where the large intestine drops or slips outside of the anus, which is very painful. We want to avoid that at all costs. And mental health complications can also arise. So if we have that stress and we bottle it up, it could just keep going and we wouldn't really have anything that would calm us down, essentially. So for medical treatment for IBS-C, there's a few things that doctors may recommend. One includes, let me move my screen over here, sorry. One includes an exercise regimen. So if you exercise a little bit more, this can kind of help with your digestive system. Again, the gut is like the second brain, and when our brain is expelling stress, that can also help our gut in a sense. Also participating in relaxing activities, kind of going off of that on the opposite end, just to kind of calm ourselves and bring us down to a state of where we're not at high stress or putting a lot of stress on our bodies. Also, they may recommend medications, including antidepressants, probiotics, laxatives, etc. So, what do we as dietitians like to do? Well, there's a few things that we can do with IBS-C. We can record foods, that increase, or we can advise them to record foods that increase constipation. So if they experience constipation again, they can record the food that they ate beforehand, and we can assess it to see if it's related to that in any way. We can also advise them to increase their fiber intake to help speed up digestion. Excuse me, and include peppermint, which actually helps to calm the muscles of the stomach, to improve the flow of bile, which helps food pass more quickly. We can also advise them to drink plenty of water. If they're having higher fiber intake, they will need to drink more water. They also need to avoid high gas foods to, decrease how much distension is going on in the stomach because it can cause discomfort. And lastly, which this will come up again, so we would want to advise them to eat low FODMAPs foods. So FODMAPs stands for, well, we would want to recommend a diet low in fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. And this is the most common prescription that we can do as dietitians to help with IBS. So I've included on the left or the right side for you to see what some high FODMAP foods are and what some low FODMAP alternatives would be. And so we're basically just trying to watch kind of the sugars that they're consuming because it could cause flare-ups with IBS. Oops. Okay, so now we're going to be talking about IBS-D, which stands for IBS diarrhea. It is characterized by loose and watery stools, and some signs and symptoms can include, some weight loss or body mass loss. They can also experience gas and abdominal pain, just like with IBS-C, but they can also experience nausea and vomiting, and it could lead to severe anemia. IBS-D could also be caused by infection, or it could be related to infection as far as if there's infection in the GI tract. It also can be brought on by emotional stress. And usually, people with IBS-D have frequent bowel movements. And for tests for diagnosis, there's also a couple ways that we can test to see if a person has IBS-D. So we could take a stool sample or a test to assess if there's bacteria or pests or parasites in the large intestine. We can also do an upper endoscopy, which is kind of the reverse of a colonoscopy. So, an upper endoscopy is basically putting a tube from the mouth to the stomach and assess the upper GI and look for bacterial overgrowth in the upper GI. Um, and then we could also do a lactose intolerance test or some other type of food allergy or sensitivity test to see if it might be a certain food related incident. Okay, so with IBS-D, what could happen if it goes untreated is there could be severe nutrient loss. If there's vomiting and severe diarrhea, we could be losing a lot of nutrients there. Malnourishment could also occur. Weight loss could happen in response to severe diarrhea and excessive diarrhea. Dehydration can also occur because you're getting rid of a lot of water in your body. And so we would want to make sure that doesn't happen. And then also, like IBS-C, long-term stress can occur if this goes untreated, and it's just not good on mental clarity and mental health. So for IBS-D, some of the treatments that a doctor may recommend for them is some medications, of course, and this would also include antidepressants, just like IBS-C, but probiotics and antidiarrheal pills or medications may also be recommended just to help prevent diarrhea from happening. They would also probably advise to manage stress, decrease or manage stress, increase the use of antibiotics, and maybe to increase exercise to, again, like IBS-C, have less stress on our brain so that our gut can also, form or perform as well as our brain. So what we can do as dietitians, what we can recommend, sorry, my phone's going off. What we can recommend is to avoid stimulants like caffeine, alcohol, nicotine, energy drinks, etc., because stimulants help to increase the bowel movements. So we don't really want them to be increasing, we want them to be decreasing. And again, like IBS-C, we'd want them to have low FODMAPs just to decrease that sensitivity and reaction when it comes to digesting food. Avoiding gluten also has been proven to help. A lot of people, surprisingly, what I researched, people who have celiac disease can be associated with IBS-D, and so it might be beneficial for some of these individuals to avoid gluten just to see how it goes for them. And also drink plenty of fluids just to, make sure we don't get too dehydrated. And then also avoid foods that trigger symptoms, just like with IBS-C. So if there's something that triggers it, we would want to avoid it and write it down and make sure to consult, like that they consult with a dietitian to make sure that everything is going well and they don't have anything to worry about, or to assess the food. So our last type we're going to be talking about is IBS-M, which is a mixture of IBS-C and IBS-D. So they experience both constipation and diarrhea. So for this one, the signs and symptoms and like the labs run and complications are the same as those for IBS-C and D. Sorry, excuse me. Treatment is also typically the same as IBS-C and IBS-D, but antispasmodic medications, such as like something that would decrease spasms in the GI tract or the large intestine, and diet equivalents, basically wanting to balance it out and making sure we're not having too much of one thing or too much of another. maybe recommendations as well. What I saw, basically recommending low FODMAPs seemed to help a lot with IBS-M, and so it's just kind of a mix of both. Okay, now I see in our class we have 3 people joining us today. So we are going to be playing IBS Jeopardy, and we're going to do, I would say, probably 3 questions each, and then we will tally up the scores and see what who wins. All right, so Timmy, how about you go first for us today and choose anything that you would like?
I'm going to choose IBSD for 400.
Okay. IBSD for 400, we'll do that. Oh, the daily double. What do you know? So this is worth 400 points. So if you could explain to me what is a common prescription associated with treating IBS-D? You can just name one. You don't have to name all of
I'm going
them.
to say anti-diarrheal medication.
Okay. Is that your final answer?
Yes.
Okay, let's see if it's right. Okay, so anti-diarrheal and got 400 points. All right. So that's one question for you. And now we're going to move on to Kimmy. Oops, back to the board. Sorry. Um, okay, Kimmy, take your pick.
I'm going to choose IBS Facts for 500.
Okay, we're going to do IBS facts for 500, going for 100 points more. Okay, so what is different about treatment for IBS-M in comparison with IBS-C and IBS-D?
Um, I don't know. I'm sorry.
That's okay. That's okay. You don't have to know. It's no big deal. So, oh, and I just remembered, Timmy, that's actually 800 points because it's daily double. Okay, so let's see what the answer is, and then I can explain it a little bit better to you, Kimmy. So it is including antispasmodic medications and having diet equivalents. So including the medications that reduce spasms in the GR tract and also making sure the diet is balanced. But no worries, you'll have another chance to have another, well, 2 other questions. Okay, and for Jimmy,
I'm going to choose IBSC for 500.
okay, IBSC for 500. Okay, describe constipation for me, Jimmy.
Is it like when the poop gets like all hard and lumpy?
All right, is that your final answer?
Yes.
Okay. So yes, it's a hard and lumpy stools. So you'll get 500 points for that. So right now, the leader of the board is Timmy with 800 points, Jimmy with 500, and Kimmy, we will make up those points, I promise. Okay, Timmy, take your second pick. You have a little wiggle room.
IBS facts for 200.
Okay, IBS facts for 200. So how many types of IBS are there?
3.
Is that your final answer?
Yes.
Correct. There's 3. Can you name those off for me?
It says C, D, and M.
Good job. Good job. All right. And okay, Kimmy, it's your turn next.
IBSD for 500, please.
Okay, IBSD for 500. Okay, so what was the picture on the first slide when describing IBSD? This is kind of a question to remember by.
Was it like people running to the toilet?
That's your final answer?
Yep.
Okay. Yes, you are correct. So you get 500 points. Okay. Yes, it was people running to the toilet because I did not want to show diarrhea on the slide. Okay, Jimmy, it's your turn. I think all the 500s are used up, if I'm not mistaken.
IBS-C for 300.
Okay, IBS-C for 300. So all of these are treatments for IBS-C except one. Which one is it?
Is it avoid stimulants?
Okay, is that your final answer?
Yeah.
Okay, let's see. Oh, made a noise. So yes, it is avoid stimulants. So you will get 300 points. Okay. Oh, get it back to the board. I always forget that. Okay, Timmy, it's your turn again.
IBSD for 100.
Okay, IBSD for 100. So IBSD stands for irritable bowel syndrome blank.
Diarrhea.
Is that your final answer?
Mm-hmm.
Okay. So yes, it is diarrhea. So you will get 100 points for that. Okay. Kimmy, it is your turn. What do you choose?
IBS facts for 400.
Okay, let me see if we have used up all the 400s. Oh, no, okay. So IBS facts 400s. How much of the population in the US is affected by IBS? And this is not the people who have gone in to be treated for it. It's how many people total, untreated and treated.
10 to 15%?
Okay. Is that your final answer?
Yes.
There you go. Yes, correct. So it is 10 to 15%, but only about half of that population goes in to get checked and assessed for IBS. All right, and Jimmy, you are last.
IBS facts for 200.
Okay. So IBS facts for 200. Oh, we already did that. Choose another one.
IBS-C for 300.
Okay. IBS-C for 300. Oh, we already did that one too. Okay.
200, I guess.
Okay, 200. Okay, give me a common complication with IBS-C. This includes what could happen if IBS-C is left untreated.
I don't remember.
Oh, come on, you can guess something.
I can't think of anything.
Okay. Well, here's some complications that can be associated with it. So it includes anal fissures, fecal impaction, hemorrhoids, rectal prolapse, or mental and health complications. But that's okay. That's no problem. I know that's a lot of information to understand. Okay. All right. Let me tally up these scores. And I'm going to go to this last one here really quick. All right, Timmy has 1100, Kimmy has 900, and Jimmy has 800. So Timmy, you are the winner, and I will get you a special treat after class. Okay, so I think that is the end of our presentation. Here are the references if any of you guys wanted to go back and look over them. And that is all I have for you today. So I hope you guys enjoyed this little presentation and got to learn a little bit more about IBS and what it's like and, how to treat it if, you become a registered dietitian. Okay. Thanks, guys.